Have you ever woken up in the middle of the night, heart pounding, with that persistent throbbing pain in your temples that just won't let you rest? Or perhaps you've sat nervously in your doctor's office, watching as they check your blood pressure again and again, their expression growing more concerned with each reading? I understand that feeling all too well. That moment when your doctor looks up from the monitor with that worried expression that makes your heart sink even further. Living with hypertension isn't just about managing numbers. It's about the constant anxiety that follows you everywhere. The fear that strikes when you're playing with your grandchildren and suddenly feel lightheaded. The way you hesitate before accepting an invitation to a friend's dinner, wondering if the food will trigger another crisis. The prescription bottles that multiply in your medicine cabinet, each with their own set of side effects that sometimes feel worse than the condition itself. I've spent the last 15 years helping thousands of patients take back control of their cardiovascular health. And what I've discovered might surprise you. While most doctors simply hand you a prescription and tell you to cut salt, exercise more, and lose weight, as if these changes were as simple as flipping a switch, few are talking about the hidden dangers lurking in some of the very foods you might be consuming, believing they're helping your condition. Yes, you heard that right. Some of the fruits you're consuming, believing they're helping your condition, might actually be silently pushing your blood pressure higher and putting your heart at serious risk. Today, I'm going to share something that the pharmaceutical companies and even many medical professionals don't want you to know. The truth about which fruits are secretly sabotaging your blood pressure control and the simple, natural alternatives that have helped my patients reduce or even eliminate their dependence on medication. These are strategies that address the root causes of hypertension, not just mask the symptoms with drugs that you're told you'll need to take for the rest of your life. Imagine waking up feeling truly rested, checking your blood pressure and seeing normal readings consistently, without the roller coaster of highs and lows. Picture yourself enjoying family gatherings without anxiety, traveling without a bag full of medications, and living each day with energy and confidence rather than fear and restriction. This isn't a fantasy. I've seen these transformations in my own practice, with people just like you who had been told their hypertension was something they would have to manage forever. Before we continue, I'd love to know, are you or someone you love struggling with high blood pressure? How long have you been dealing with this condition, and what has been your biggest challenge in trying to control it? Drop a comment below, sharing your experience. Your insight might help someone else who's facing similar struggles, and I personally read every comment to better understand what you're going through.
Now, let's dive into the surprising truth about fruits and hypertension that your doctor probably never mentioned. The information I'm about to share could be the missing piece in your journey toward better heart health and freedom from the constant worry about your next blood pressure reading. While most of us have been taught that fruits are universally healthy, the reality is more complex when it comes to hypertension. According to recent data from the National Center for Health Statistics, nearly half of American adults, approximately 119.9 million people, have hypertension, yet only about 1 in 4 have their condition under control. Even more concerning, hypertension contributed to over 664,000 deaths in the United States in 2023 alone. These statistics are alarming, but what's truly shocking is how little attention is paid to the specific foods that might be worsening this epidemic, especially certain fruits that many people consume daily in an attempt to eat healthier. Let's start with canned fruits. Those convenient pantry staples that many people rely on, especially when fresh options aren't available. What most people don't realize is that these products often come swimming in heavy syrup loaded with added sugars. A single cup of canned peaches in syrup can contain up to 40 grams of sugar. That's 10 teaspoons. Research has shown that excessive sugar intake contributes significantly to hypertension by causing weight gain, insulin resistance, and inflammation in your blood vessels. The American Heart Association recommends limiting added sugar to no more than 25 grams daily for women and 36 grams for men, meaning just one serving of syrupy canned fruit could potentially exceed your entire day's limit. Instead, if you must use canned fruits, Always choose varieties packed in water or their own juice, and be sure to drain and rinse them before eating to reduce sugar content even further. Next on our list might surprise you: dried fruits. Those seemingly innocent raisins, dried apricots, and prunes that are often marketed as healthy snacks can be problematic for people with hypertension, for two reasons. First, the dehydration process concentrates the natural sugars, turning what was once a reasonably sweet fruit into a sugar bomb. Just 1/4 cup of raisins contains about 29 grams of sugar, nearly as much as a candy bar. Second, many commercial dried fruits contain added preservatives, including sulfites and, surprisingly, additional sodium. This hidden sodium combined with the sugar concentration creates a perfect storm for elevated blood pressure. If you enjoy dried fruits, look for unsweetened varieties without preservatives and consume them in very small portions, always paired with a source of protein or healthy fat to slow sugar absorption.
I want to take a moment to ask something important. When was the last time someone really listened to your concerns about high blood pressure? Not just the numbers from your test, but how you feel living with this condition day after day. Many people tell me privately how isolated they feel, as if no one truly understands the constant weight they carry, that silent fear that accompanies each heartbeat. If this resonates with you, I'd really appreciate hearing your experience in the comments below. Something as simple as, "I've been battling hypertension for X years, and what troubles me most is," your biggest concern. Sharing your story not only helps me create more relevant content for you, but also shows others watching that they're not alone in this struggle. Sometimes knowing there's someone going through the same situation already brings immense relief. And who knows, your experience might be exactly what someone needed to read today to find hope. Now, let's continue our conversation about how we can transform this reality together. Perhaps the most surprising fruit on our warning list is grapefruit. While celebrated for its vitamin C content and weight management benefits, grapefruit contains compounds called furanocoumarins that interfere with how your body metabolizes certain medications, including many common blood pressure drugs. This interaction can cause the medication to build up to dangerous levels in your bloodstream or prevent it from working effectively. Studies show this effect can last up to 72 hours after consuming grapefruit. What makes this particularly concerning is that many people taking hypertension medications are never properly warned about this interaction. If you're on blood pressure medication, particularly calcium channel blockers like amlodipine, felodipine, or nifedipine, or statins like atorvastatin, Lipitor, you should avoid grapefruit and its juice entirely unless your doctor specifically confirms it's safe with your particular medication regimen. But there's one fruit that stands above all others in its ability to potentially raise blood pressure, yet it rarely makes it onto warning lists: licorice. While not commonly thought of as a fruit, licorice root is actually derived from the root of the Glycyrrhiza glabra plant and is used in many fruit-flavored products and herbal teas. Licorice contains glycyrrhizic acid, which can significantly raise blood pressure by causing your body to retain sodium and lose potassium, a dangerous combination for anyone with hypertension. Research has found that consuming as little as 2 ounces of black licorice daily for 2 weeks can cause dangerously high blood pressure and abnormally low potassium levels, particularly in adults over 40. Even more concerning, a recent randomized crossover trial found that licorice is more potent than previously thought, with significant increases in blood pressure occurring after a daily intake of only 100 milligrams of glycyrrhizic acid, much less than was previously considered problematic. Always check ingredient lists carefully, as licorice can hide in products like herbal teas, some candies, and even certain natural cough remedies.
Now, you might be wondering about fruit juices. While whole fruits generally contain fiber that helps slow sugar absorption, fruit juices deliver all the sugar without the beneficial fiber. A single 8-ounce serving of apple juice contains about 24 grams of sugar with little to no fiber. This rapid sugar hit can lead to insulin spikes that over time damage blood vessels and contribute to hypertension. Even worse are the commercially prepared smoothies and fruit drinks that often contain added sugars on top of the naturally occurring ones. Some store-bought fruit smoothies can contain upwards of 50–60 grams of sugar per bottle. Instead of juices, eat whole fruits and make water your primary beverage. If you enjoy the flavor of fruit in your drinks, try infusing water with a few fresh berries or citrus slices for taste without the sugar overload. Speaking of whole fruits, let's address those with naturally high sugar content. Fruits like mangoes, cherries, and grapes, while nutritious in many ways, contain significantly higher amounts of fructose than others. A single mango can contain up to 46 grams of sugar. For individuals with insulin resistance or metabolic syndrome, which often accompanies hypertension, these high sugar fruits can exacerbate blood sugar issues that indirectly affect blood pressure. If you have hypertension alongside insulin resistance or diabetes, consider limiting these higher sugar fruits and opt instead for lower sugar alternatives like berries, which offer similar nutritional benefits with less impact on blood glucose levels. It's not just fresh fruits that can be problematic. Many packaged products marketed as fruit snacks or fruit leathers are essentially candy with minimal actual fruit content. These products are often loaded with added sugars, corn syrup, and artificial colors and flavors. The combination of high sugar content and artificial additives can contribute to inflammation and oxidative stress, both key factors in the development and progression of hypertension. Always read labels carefully and choose whole, unprocessed fruits over manufactured fruit products whenever possible. So what can you eat? Fortunately, there are plenty of fruits that can actually help lower your blood pressure rather than raise it. Berries, particularly blueberries, strawberries, and blackberries, are rich in anthocyanins, powerful antioxidants that have been shown to reduce blood pressure by improving the function of blood vessels and reducing inflammation. A large study published in the American Journal of Clinical Nutrition found that individuals who consumed the highest amounts of anthocyanins had an 8% reduction in the risk of developing hypertension compared to those with the lowest intake. Aim for at least one serving of mixed berries daily, either fresh or frozen without added sugar.
Bananas are another excellent choice due to their high potassium content. Potassium helps your body excrete excess sodium through urine, which can lower blood pressure. One medium banana contains about 422 milligrams of potassium, about 9% of the recommended daily intake. Other potassium-rich fruits include avocados, yes, they're technically a fruit, which provide about 975 milligrams per serving, and oranges, which offer around 237 milligrams each. Incorporating these potassium powerhouses into your daily diet can help naturally counterbalance the effects of sodium and support healthy blood pressure levels. Kiwi fruits have shown remarkable benefits for hypertension in clinical studies. A study published in the journal Blood Pressure found that consuming 3 kiwi fruits daily for 8 weeks resulted in a significant reduction in both systolic and diastolic blood pressure compared to an apple control group. Researchers believe this effect is due to kiwi's unique combination of potassium, vitamin C, and bioactive compounds called lutein and zeaxanthin, which help reduce inflammation and improve blood vessel function. Try adding sliced kiwi to breakfast or enjoying it as an afternoon snack to capitalize on these benefits. Apples deserve special mention for their hypertension-fighting properties. They contain quercetin, a flavonoid that acts as a natural ACE inhibitor, similar to many prescription blood pressure medications, but without the side effects. Apples also provide soluble fiber in the form of pectin, which has been shown to lower both cholesterol and blood pressure. A large study found that regular apple consumption was associated with a 20% reduced risk of heart disease, with blood pressure improvement being one of the key factors in this protective effect. Remember that much of the beneficial fiber and quercetin is found in or just below the skin, so eat apples unpeeled whenever possible. Beyond specific fruits, the way you incorporate them into your overall eating pattern matters tremendously. The DASH diet, Dietary Approaches to Stop Hypertension, has been extensively studied and consistently shown to lower blood pressure as effectively as medication for many people. This eating plan emphasizes fruits, vegetables, whole grains, and lean proteins while limiting sodium, added sugars, and unhealthy fats. Research demonstrates that following the DASH diet can lower systolic blood pressure by an average of 8 to 14 points, which is comparable to the effect of many prescription medications. The beauty of this approach is that it addresses multiple aspects of cardiovascular health simultaneously, not just blood pressure in isolation. Timing of fruit consumption can also impact its effect on blood pressure. Eating fruit on an empty stomach can cause more rapid sugar absorption and potentially greater blood pressure fluctuations, especially in those with insulin sensitivity issues. Instead, consume fruits as part of a balanced meal or snack that includes protein and healthy fats, which helps slow sugar absorption and provide a more steady energy release. For example, rather than eating an apple alone, pair it with a small handful of almonds or a tablespoon of natural peanut butter to create a more balanced snack.
It's important to remember that individual responses to specific fruits can vary based on your unique health profile, current medications, and genetic factors. What causes a blood pressure spike in one person might have minimal effect on another. This is why personalized nutrition approaches are so valuable for managing hypertension effectively. Consider keeping a food diary that includes blood pressure readings to identify your specific triggers and safe foods. Over time, patterns will emerge that can guide your dietary choices more effectively than generic recommendations. Beyond fruit choices, several other dietary factors significantly impact blood pressure control. Sodium intake remains one of the most important considerations, with the American Heart Association recommending no more than 2,300 milligrams daily for most adults and ideally closer to 1,500 milligrams for those with hypertension. What many people don't realize is that over 70% of dietary sodium comes from processed and restaurant foods, not from salt added during cooking or at the table. Reading nutrition labels and choosing low-sodium versions of common products like bread, canned vegetables, and salad dressings can make a substantial difference in your overall sodium intake. The Mediterranean diet offers another evidence-based approach to blood pressure management through nutrition. This eating pattern emphasizes olive oil, nuts, fish, whole grains, and abundant fruits and vegetables while limiting red meat and processed foods. Multiple studies have shown that following a Mediterranean diet can lower blood pressure and reduce cardiovascular risk by as much as 30%. The combination of omega-3 fatty acids from fish, monounsaturated fats from olive oil, and antioxidants from fruits and vegetables creates a powerful synergy that supports overall vascular health beyond what any single food component could provide alone. For those who enjoy a daily cup of coffee or tea, some good news. Moderate caffeine consumption, about 200 to 300 milligrams daily, equivalent to 2 to 3 cups of coffee, does not appear to cause lasting increases in blood pressure for most people. However, if you find yourself sensitive to caffeine's effects, consider switching to decaffeinated versions or herbal alternatives. Hibiscus tea deserves special mention. Clinical studies have found that drinking 3 cups of hibiscus tea daily can lower systolic blood pressure by 7 to 10 points in people with mild to moderate hypertension. This effect is likely due to hibiscus's anthocyanins and other bioactive compounds that help relax vascular vessels and act as natural ACE inhibitors.
Beyond diet, stress management plays a crucial role in blood pressure control that is often underestimated. Chronic stress triggers your body's fight or flight response, releasing hormones like cortisol and adrenaline that temporarily raise blood pressure. When this stress response remains activated long-term, it can lead to sustained hypertension and damage to blood vessels. Incorporating stress reduction practices like deep breathing, meditation, yoga, or simply spending time in nature can significantly impact your blood pressure readings. A meta-analysis of studies on meditation found that regular practice reduced systolic blood pressure by an average of 4.7 millimeters of mercury and diastolic pressure by 3.2 millimeters of mercury, comparable to the effect of some blood pressure medications. Quality sleep is another often overlooked factor in blood pressure management. During normal sleep, your blood pressure naturally drops by 10 to 20%, a phenomenon called nocturnal dipping. People who don't experience this nighttime drop due to poor sleep quality have a significantly higher risk of cardiovascular events.
Aim for 7 to 8 hours of uninterrupted sleep nightly and address any sleep disorders like sleep apnea, which is particularly common in people with hypertension. Simple sleep hygiene practices like maintaining a consistent sleep schedule, avoiding screens before bedtime, and creating a cool, dark sleeping environment can improve both sleep quality and blood pressure control. Regular physical activity remains one of the most effective lifestyle interventions for hypertension. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic activity or 75 minutes of vigorous activity weekly, plus muscle-strengthening activities twice weekly. This level of activity can lower systolic blood pressure by an average of 5 to 8 millimeters of mercury. What's particularly encouraging is that even light activity like walking can provide significant benefits if done consistently. Start where you are. Even 10-minute walks 3 times daily can improve blood pressure if you're currently sedentary. Gradually increase duration and intensity as your fitness improves. I want to emphasize that managing hypertension effectively typically requires a multifaceted approach. While making smart fruit choices is important, it's just one piece of a larger puzzle that includes overall diet, physical activity, stress management, adequate sleep, and for many people, appropriate medication. Work closely with your healthcare provider to develop a comprehensive plan tailored to your unique health profile, preferences, and goals. Regular monitoring, either at home or in clinical settings, provides valuable feedback on how your body is responding to these changes and allows for timely adjustments when needed.
For those using home blood pressure monitors, proper technique is essential for accurate readings. Measure at the same time each day, preferably in the morning, before taking medications, and in the evening. Sit with your back supported and feet flat on the floor, with your arms supported at heart level. Rest for at least 5 minutes before taking reading, and avoid caffeine, exercise, and smoking for at least 30 minutes prior. Take 2 or 3 readings, 1 minute apart, and record all values. These consistent measurements over time provide a much more accurate picture of your blood pressure control than occasional readings in clinical settings. If you've reached this point in our conversation, you probably know firsthand how challenging it can be to live with high blood pressure. The constant monitoring, the medication adjustments, the lifestyle modifications that sometimes feel overwhelming. I want you to know that you're not alone in this journey. The physical challenges of hypertension are difficult enough, but the emotional toll, the anxiety, the frustration, the feeling that your body has somehow betrayed you can be equally burdensome. What I've observed in my years of clinical practice is that the people who successfully manage their hypertension long-term are those who find a supportive community, who are gentle with themselves when they have setbacks, and who celebrate even small victories along the way. Every healthy meal choice, every walk around the block, every conscious breath during a stressful moment, these are all meaningful steps toward better health. If you've reached this far in our conversation, you probably know firsthand how difficult it can be to live with constantly elevated blood pressure, the worry that comes with each reading, the side effects from medications, the restrictions that seem to steal some of the joy from everyday life. I want you to know that you're not alone on this journey. Our channel was created specifically to build a supportive community for people like you who are seeking natural, effective alternatives for cardiovascular health. Every week, we share new discoveries, simple recipes that naturally help control blood pressure and answer questions that doctors often don't have time to explain during brief appointments. If this content resonated with you, please consider subscribing to our channel and activating notifications. This way, we can walk together on this health journey, one step at a time, without rushing, but with the consistency your heart deserves. I don't promise miracles, but I do guarantee honest information based on serious research and the experience of those who've achieved real results. Take good care of yourself, and I hope to see you in our next video, where we'll continue our conversation about living better even with hypertension. Your heart thanks you for every small bit of care you dedicate it to today.